Welcome to another episode from the Veterinary Medicine Digest. Today we're diving into an innovative surgical approach for a common and often debilitating condition affecting our beloved spaniel breed dogs, Humeral Intracondylar Fissure, or HIF. This condition is a frequent cause of lameness in the thoracic limb, and tragically, it can predispose dogs to severe condylar fractures with minimal trauma. For a long time, HIF was thought to be due to incomplete union of two ossification centers of the humeral condyle. However, with the rise of advanced imaging techniques like computed tomography scans or CT, a new theory has gained significant traction, the stress fracture theory. This theory is supported by observations that many affected dogs are adults. Fissures can develop or propagate in previously normal elbows, and they can extend beyond where the cartilaginous plate of ossification centers would reach. While debate continues, it's possible that these hypotheses are valid, with incomplete ossification applying to younger, skeletally immature dogs and stress fractures to older ones. A crucial recent finding is the presence of cartilaginous lesion on the caudal aspect of the humerus in spaniel dogs with HIF. This lesion is a result of humeral anconeal incongruity, suggesting that abnormal cyclic loads on the humeral condyle might be the root of these stress fractures. If this hypothesis holds true, then healing the HIF could be achieved by correcting or at least improving this humeral anconeal incongruity. This brings us to a promising solution investigated in our featured study, the oblique proximal ulnar osteotomy, or PUO. The hypothesis is that by performing an oblique PUO, the proximal ulnar segment translates proximally and tilts due to the triceps pull. This movement could cause the tip of the anconeal process to shift in a cranio-proximal direction, thereby distributing the abnormal cyclic load on the humeral condyle, allowing the fissure to heal. This innovative idea has already shown success in a case report involving a Shetland sheepdog. Now, let's explore the results of the study, which involved 51 elbows from 35 spaniel dogs, including English Springer Spaniels and Cocker Spaniels. The follow-up CT scans were performed at a median of 18.5 months post-surgery. The objective assessment of the HIF healing was quite compelling. There was significant increase in the mean Hansfeld units, or the HUs, within the HIF's region of interest, jumping from 640 HUs previously to 835 HUs on the last follow-up, and the p-value for that is 0.001. This is a strong indicator for bone healing. Similar significant improvements were seen on the bone density on the lateral and medial aspects of the humeral condyle, as well as the total condyle. Intriguingly, young dogs, specifically those under 14 months of age, showed the highest increase in HU at the fissure level, gaining an average of 384 units. These young dogs also presented with wider fissures and less sclerosis compared to the older dogs. Furthermore, the study objectively confirmed that the anconeal tip indeed displaced significantly in the cranio-proximal direction after the PUO. And again, the p-value for that is 0.001. Subjectively, the results are equally positive. Partial or complete healing of the HIF was confirmed in 14 elbows, which is a remarkable 80.3% of cases. Breaking it down further, 28 elbows, which is 54.9%, were considered healed, and 13, or 25.4%, were healing. This subjective assessment strongly correlated with the objective CT findings. As for the dog's comfort at the 6-week follow-up, an impressive 94% of elbows showed no discomfort on extension, indicating significant pain resolution. Regarding the complications, the oblique PUO demonstrated a notably overall complication rate of 9.8%, comprising of 2 major and 3 minor complications. Minor issues, such as intramedullary pin migration, occurred in a small number of limbs and were easily managed. Major complications were rare, occurring in 5 dogs or 6 limbs, with some related to the fissure not healing and others to the PUO site itself. This is in stark contrast to traditional methods. Diving into the discussion, the study conclusively demonstrated that performing an oblique PUO in dogs with HIF leads to healing of the fissure and reduction in humeral condyle sclerosis in the majority of cases, thus validating the study's hypothesis. The underlying issue of humeral anconeal incongruity is believed to cause different manifestations of HIF depending on the dog's age. Wider fissures and less sclerosis in young dogs versus increased sclerosis and stress fracture formation in older dogs. The PUO procedure addresses this by causing the anconeal process to move cranio-proximal, thereby halting the abnormal mechanical overload of the humeral condyle. This rebalances the bone's natural repair mechanisms, leading to an observed healing. A key part of the surgical technique involves releasing the interosseous ligament and placing an intramedullary K-wire to control segment displacement. This routine use of human recombinant bone morphogenic protein 2, or RhMBP2, in older dogs less than 8 months was found to be highly effective in promoting bone union, drastically reducing the non-union rate to just 1.9% from a previously reported 31.1%. This superior healing observed in young dogs is attributed to their enhanced healing activity, bone metabolism, and increased vascular capacity. In contrast, the presence of fibrous and necrotic tissue, coupled with sclerosis, can impede healing in older dogs. The study highlights that sclerotic bone is stiffer and more prone to sudden fracture, explaining why older dogs with severe sclerosis might experience catastrophic failures like Y fractures. Crucially, the study provides a compelling comparison to the traditional surgical treatment of HIF, the placement of a transcondylar screw. While screws aim to stabilize the condyle and reduce fracture risk, their success in achieving fissure healing and assessment is often hampered by metallic artifacts on CT scans. The most significant advantage of PUO is the drastically lower complication rate compared to screws. Traditional screw placement is associated with a high overall complication rate, ranging from 15 to 69%, with surgical site infections being a major concern reported in 42%. By avoiding the transcondylar screw, many of these severe complications are bypassed. While PUO does have its own potential complications, these are generally more benign and easier to address, and they don't seem to impact long-term outcomes as severely as screw-related complications. Although PUO requires a longer recovery period, with lead-only walks for up to 6 months compared to the faster recovery with screws, the authors believe that the long-term benefits of achieving fissure healing and avoiding severe post-operative complications far outweigh its drawbacks. In certain cases, such as in dogs over 8 years old, those with severe humeral condylar sclerosis, or when client compliance with post-operative instructions is a concern, a combination of PUO and transcondylar screw might be considered. Furthermore, PUO has proven to be an effective revision strategy for dogs that have experienced major complications from previous transcondylar screw placements, such as chronic infection or implant loosening. In conclusion, this study provides strong evidence that oblique proximal ulnar osteotomy is an effective and promising treatment option for humeral intracondylar fissures, particularly in young dogs. It successfully leads to the desired anatomical changes and significant healing of the fissure, offering a safer and more reliable alternative to traditional methods. That is it for this study. Thank you for listening to the Veterinary Medicine Digest. The title for the reference paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep your minds inspired, hearts light, and tails wagging.